Hi, welcome to the Hope Medical Clinic HIPAA training class. Our hope is, after watching this presentation, you'll have a better understanding of patient confidentiality and the HIPAA guidelines. As a volunteer at Hope Medical Clinic, we want you to be knowledgeable about patient rights and as defined by HIPAA. We want you to understand your responsibilities as a healthcare provider. And we want to make sure that patient information is handled confidentially at all times at our clinic. What does HIPAA stand for? HIPAA stands for the Health Insurance Portability and Accountability Act. It is a law related to the delivery of health care. HIPAA rules set the standards for sharing patient information while protecting the privacy of the patient. Congress called on the Department of Health and Human Services to issue patient privacy protections as part of HIPAA. These protections, known as the Privacy Rule, were signed into law in 2001 by President George W. Bush and took effect in 2003. What is PHI? PHI is Protected Health Information. Protected health information is individually identifiable health information created, received, transmitted, and are maintained by a covered entity. This includes information relating directly or indirectly to the patient's past, present, or future physical or mental health, their demographic information, and their health care bills and payments. PHI can include information in the patient's medical record, conversations about a patient care, or treatment with others. Information on PHI can include personal information such as any of these listed on the slide. The Privacy Rule portion of HIPAA gives citizens new rights to privacy by requiring all organizations that handle health information, whether written, oral, or computer-based, to reasonably safeguard that information. The rule provides patients with access to their medical records and more control over how their personal health information is used and disclosed. It also establishes penalties for organizations that fail to comply with the law. In February 2009, CVS agreed to pay $2.25 million in a settlement reached for potential privacy violations affecting millions of patients. It was the largest settlement of its kind in the U.S. history. April 2010, a former UCLA medical employee was sentenced to 4 months in prison after admitting to snooping in a patient's record. The employee admitted to illegally reading private and confidential medical records, primarily of celebrities and other high-profile patients. In July 2010, Rite Aid and CVS agreed to pay $1 million for patient privacy violation. Investigators revealed Rite Aid and CVS disposed of pill bottles and prescriptions that included patient information in trash cans without proper safeguards. Federal penalties for violating the privacy regulation range from a $100 fine per violation for disclosures made in error up to 10 years in prison for malicious use of records. HIPAA rules say you can't talk about patients outside the office with anyone. Clinicians should only access the medical information that's needed for their job or clinical experience. We need patients to give us permission before we can give information to others on their behalf. And we need to keep medical records in a secure place, both paper and electronic. Curiosity, concern, malice, and or profit are not legitimate business reasons to access information. What are the organization's responsibilities? We have 3 areas that we're responsible for: administrative, physical, and technical. The HIPAA security rule provides physical, technical, and administrative safeguards of electronically stored PHI. The organization must have policies and procedures for employees to follow to make sure the patient's information remains secure, and they must train the employees on these procedures. Physical, the organization must control how the patient records are physically accessed and prevent inappropriate access using locks and other security systems. Technically, the organization must have systems to control computer access and to monitor protected communication that flows electronically over networks. As a volunteer at Hope Medical Clinic, what can we do to make sure we're protecting our patients' privacy? Putting information in dumpsters is not an acceptable form of disposal. Proper disposal methods include shredding paper records or placing in a locked container until it can be disposed of properly. Other actions you can take include, if you see a medical record in public view where patients or others can see it, cover the file up, turn it over, or find another way to protect it. When you talk to patients, try to prevent others from overhearing the conversation. Hold your conversation in private areas and do not discuss while you're in a public area. If you're using electronic medical records, you should have a unique password. Don't share it with others, and make sure it's a strong password. Do not access information on yourself, your family, your friends, staff, or any other person. You have a duty to report any breach in confidentiality to your supervising doctor. Some other reminders are, guard your PC, laptop, or cell phone. Lock your computer screen when you step away from your work area, and secure devices in a locked car trunk when you're traveling. You can find more information online about HIPAA if you have any questions. Now let's review just a little bit. Let's suppose you saw your neighbor in the waiting room. You're not allowed to tell anyone else about it. Let's suppose you hear an interesting story about one patient who had contracted an unusual disease. You must not share this on Facebook or any other social networking site. Let's suppose you're very excited to see a patient's progress and you're working in the waiting room with a friend. You're not allowed to talk about it in the area around others. Together we can do more to care for our patients and their family. We have a confidentiality agreement that we'd like for you to sign. Thanks for listening, and welcome to the Hope Clinic.